I am demonstrating the Mills technique, which is a high velocity, low amplitude thrust to my patient's radial head. The indications or implications for doing this technique would be hypomobility of the radial head, and contraindications would be that the patient had a fracture, would be in the inflammation stage of an injury, was hypermobile, I think I already said that, and any wounds over the area or pain in this position, or therefore the patient could not get into extension. So that would be contraindications. So the first thing I would do is I'm on the affected side, my patient is standing. I would feel for that radial head and move any additional tendons or tissue out of the way to keep my thumb on that radial head and stabilizing around the others, around the rest of the radioulna. And then at the distal end, I would put her wrist into, she's in pronation and flexion, and I would somewhat feel around, kind of into that ulnar deviation for her, to bring her into that max tension. And then with a quick thrust, put her into, and put that radial head medial and hopefully feel a cavitation. Just because if cavitation did not occur does not mean that the technique did not work. If there was reduction of pain or reduction of symptoms with the patient, increasing range of motion, then the technique was successful. So again, this is high velocity, low amplitude technique for a hypomobile radial head.